So in this video we will understand about trabeculectomy, which is essentially a glaucoma filtration surgery. Now let us see what is trabeculectomy and why is it needed. Now we know that our eyeball is a kind of a closed structure which is divided into two parts, the front portion and the back portion. Both these parts is filled up with fluid. Now in the front portion, that fluid is called as aqueous humor. It is secreted by ciliary body. It comes out uh, from the ciliary body, goes through the pupil and then enters the angle of the eye through which it exits the eye. So this process is called as aqueous inflow and aqueous outflow. Now in a normal eye, this is absolutely well balanced so that the pressure of the whole eye is maintained in the normal levels. Now in patients whose inflow and outflow is not properly balanced, that means the inflow is continuing but the outflow is compromised. In these patients, the fluid gets collected in the eye, the pressure increases, and patient's optic nerve gets mechanically compressed, and that leads to damage to the optic nerve. Now, optic nerve is a very important structure in the eye because it carries visual impulses to the brain. So, if the optic nerve gets damaged, that will give rise to visual impairment or visual difficulties. In the initial stages, we know that in glaucoma, side vision gets affected, but if not taken care at the right time, the central vision can also get lost. So, so essentially, in glaucoma surgery, what is done is to get this balance back. A channel is created in the eye, and this channel basically helps in improving the aqueous outflow. So, as we can see from this diagram, the channel's outer end goes outside the eye, but it is covered by a tissue called as conjunctiva, and you will get a small swelling there, which is nothing but the aqueous getting drained there, which will get subsequently absorbed by the body. So this is how glaucoma surgery is done, and the idea is to maintain the eye pressure to the level that the optic nerve doesn't get damaged. With the availability of good medications, we rarely need trabeculectomy. The number of trabeculectomies which were performed about 10 years back were much higher than what are performed now. But still, we at times we have to resort to trabeculectomy when the drops really don't work, the pressure does not respond to medication, or the drops are the pressure is under control, but the glaucoma vision deterioration continues, or the patient is intolerant to medication or non-compliant to medication, not able to take drops at the right time, misses it frequently, or if the patient cannot follow up regularly because of lack of infrastructure, good eye infrastructure. In these cases, trabeculectomy is planned. Post-op course is very important in glaucoma surgery, and to ensure success of the surgery, post-op follow-up is as important as the surgery. So patient has to come for a follow-up at least for 4 to 6 weeks at regular intervals. Every checkup involves testing the intraocular pressure. Also in the due course, suture removal is also done. Some issues can happen in the post-op period and they have to be managed accordingly. We will discuss first about flat anterior chamber. Now, as we know that the front portion of the eye is filled up with aqueous, the front portion of the eye is called as anterior chamber and it is filled up with aqueous humor. Now, sometimes after glaucoma surgery, the channel that has been created, it filters more than what it should do, so it can cause over filtration, so the aqueous in the anterior chamber gets reduced, so the anterior chamber volume becomes less and it can form what is called as flat anterior chamber. Now once this flat anterior chamber develops, patient needs a very close watch. A lot of times these patients improve over a period of time, but if there is no improvement, these patients may have to be taken in the OT for a procedure called as anterior chamber reformation. It is usually done with the air, gas, or sometimes special viscoelastic. Another issue that can happen is called as choroidal detachment. Now this choroid is a tissue which is present between the sclera, which is the outer coat of the eye, and retina, which is the innermost layer of the eye. After glaucoma surgery, sometimes when the pressure is very low, fluid collects in choroidal tissue, and it's called as choroidal detachment. Most of the cases it's very limited. In some cases, however, the amount of detachment is very big, to the extent that the detached areas on the two opposite sides can actually touch each other, and those are called as kissing choroidals. In that situation, it becomes an urgency to take the patient in the OT to drain the fluid which is accumulated in the choroidal tissue. Most of the cases usually get resolved with drops and oral medications. And if at all patient has to be taken in OT, it is for a very small minor procedure when the choroidal fluid is drained. Post the drainage, patients recover very fast. Now, as we discussed that we have in glaucoma surgery, there is a drainage channel which is created, which carries the fluid from inside the eye to outside. Outside the eye, it is covered by a tissue called as conjunctiva, and it creates a small swelling in the area where the drainage site is situated. Now, in some patients post glaucoma surgery, this fluid collection, which is happening under the conjunctiva, starts to leak at some points where the healing is not adequate. Now, this is called as a wound leak. Now, wound leak can be a very minimal wound leak to the other extreme where it leaks significantly. So, to treat this leaks, usually a simple contact lens, we call it as bandage contact lens, is applied, and it is kept in the eye for a period of 7 to 14 days, sometimes even up to 3 weeks. And with the pressure of this bandage contact lens, the leak points which are there gets sealed. So no further treatment would be necessary after that, and lens is removed once the leak gets sealed. But sometimes the leak doesn't get sealed, or if the leak is significant, then these patients may have to be taken into the operation theater, and that leak is then secured by taking a suture, and that solves the problem. Till this point, we were seeing issues with increased drainage. What happens when the drainage is not adequate? Obviously, it will lead to high IOP. In this scenario also, we would need a very close watch. Some measures can be undertaken to improve this drainage. One of them is to remove the sutures selectively. There are some releasable sutures which are kept purposefully for this issue. They can be removed one by one. Some injections are available. They are called as injection 5-fluorouracil. This is given around the eye on alternate day basis. This basically reduces the fibrosis, and in some cases blood massage is taught to the patient, which patient has to do at home for a period of 4 to 6 weeks. Now, after the surgery, as the eye is getting used to the fluctuations of intraocular pressure, you can also have minor vision fluctuation, which will, over a period of time, approximately 6 to 8 weeks later, will stabilize. And that's the time when we recheck the power and give the final glass prescription. Now, following surgery, once you lift your upper lid, you may find a swelling like this. So please don't be worried about this swelling. This swelling basically indicates that the filtration process is happening properly and the fluid is getting collected there. Oh, this is called as bleb. What is very important is you should not rub the eyes because rubbing can lead to injury, and more important is risk of infection because of the rubbing. So avoid rubbing of the opposite eye. Another commonly asked question is, what are the chances of success of trabeculectomy? It depends on multiple things, but in general 85% of patients after trabeculectomy will not need any form of medications. Their pressure will be well controlled. In about 10% of patients, a drop may still be needed. Sometimes even two drops may be needed to control the pressure. And in about 5% cases, there may be a complete failure of the surgery, for which a repeat surgery may be needed or a different type of surgical intervention may be needed. That decision usually uh, takes about 3 to 6 months. That decision is usually taken after 3 to 6 months. And important to realize one more thing is, even if the IOP gets well controlled or the eye pressure gets well controlled, a regular follow-up will still be needed at periodic intervals as decided by the surgeon. Sometimes we have to combine trabeculectomy with cataract surgery. A lot of people ask, when the eye pressure is well controlled with medication, why a glaucoma surgery is needed. So the answer to that is, usually after a surgery, a patient who is already having glaucoma, there is a high chance of increase in eye pressure post-operatively, and this increase in eye pressure can be more detrimental to the optic nerve. So in a patient who needs more than one medication, who has significant nerve damage already, it's always better to combine these two surgeries to get better long-term outcome. Thank you.